Thank you, Galen. Thank you so much. And thank you, Ikram, for getting us started this morning. Ladies and gentlemen, it's indeed a great pleasure to see all of you here. It's exciting times, and I'm really honored to be part of this co-hosting of this event between Health AI Institute and the new brand again is Galen, Data Science AI Hub at the University of Minnesota. The summit is really unique. This is very unique setup because it brings together the best and the brightest from the university systems, the researchers, academics, scientists. We also bring together today, and over the next 2.5 days, 3 days, people from the field itself, clinicians, providers, researchers, medtech entrepreneurs, innovators, and even venture capitalists. So we are all coming from the industry. And then finally, the third leg of the stool is about policy-making process. So we'll have, over the next couple of days, you'll be hearing from both sides of the aisle, policymakers from the state level, as well as advocates from Washington, D.C., get a sense of what is a bipartisan approach to sound policy-making process. Together with you, we are here to explore not just the possibilities of AI, but how AI can be used to help transform the operations and the workings of the entire healthcare ecosystem. You see, we are facing unprecedented challenges at this time in our nation's history. Demographic changes. One of the best ways to predict the future is to look at the demographic changes that are happening in the society. And as you can see, with the aging of the population, there's extra burden being put into our delivery systems and what healthcare can deliver in terms of wellness and well-being of the American people. Also, at the same time, what is happening is there's this very significant burnout factor happening at the workplace. There are serious workforce issues that need to be addressed. And we need to be aware of that as a nation. And at the same time, lo and behold, as Professor Vipin Kumar reminds me, AI has been around for many, many years, for decades. We now are at an inflection point where AI is really taking off, and what you have is the enormous volume, variety, and velocity of data flowing into the system. New tools, new AI solutions are coming into the marketplace. And delivery systems are already strapped for financial resources, and they're saying, how do we juggle, how do we best utilize these new technologies? What is really happening is it's creating new dynamic in the marketplace, a challenge for the leaders, for people who work in the space, and the policymakers as well. So it's creating opportunities, but at the same time, creating extra burden into the system. I sincerely believe that the grand challenge before us as a nation is clear. How do we leverage AI to reimagine, reinvent, and redesign our fiscally strained healthcare ecosystem to make it more efficient, effective, and person-centered in the age of AI? We are entering a new era, new ways of running society, the socioeconomic and geopolitical systems that have yet to be defined. So the grand challenge before us is, how do we harness the power of AI to reinvent our systems and better deliver services to the American people? Our vision at Health AI Institute is really bold. We envision an ecosystem where AI-powered technologies revolutionize healthcare delivery, enabling personalized, efficient, and sustainable care. We achieve that through strategic partnerships, through collaborations, and taking a step away from our own everyday commitments and leadership challenges in our own verticals or silos, but looking across the entire continuum and saying, are there opportunities for us to operate horizontally and think horizontally as well? Is there an 80-20 rule where there are some common ground that we need to work together? That's how we at Health AI Institute want to further the cause of better service to our nation and to our people. At the end of the day, our ultimate goal is better patient outcomes. And our mission as HAI is to work with the university systems and others to foster interdisciplinary participation, people coming from all walks of life and working together for one common cause, the North Star, and enabling policies that will harness AI. The AI policies are going to evolve over the next couple of years, and we are concerned about it. So what we want to do is we want to engage you, work with you collectively and the leadership to make sure that right policies are constructed that will enable innovation, not stifle it, while at the same time ensuring that there are enough guardrails to make sure that the use of AI is ethical, right, and benefits the people. We have a huge agenda ahead of us today. So I'm going to say participate, actively listen, and give us ideas as well. And to take us forward, I'll invite two of my colleagues, Dr. Deepti Pandita and Professor Jaideep Srivastava, to come up and lead us through the entire presentation. Yes, you have. Yes. Ikram just reminded me that the governor has some welcome points for you this morning. He's not here today. He's out trying to make sure that the budget is all resolved for Minnesota, as well as traveling. So we'll listen to that presentation in a moment. But let me set the stage that Deepti, after the governor's comments, Deepti Pandita and Jaideep Srivastava will come up and take us through the next 2 days. Deepti is a clinician, practitioner, professor of medicine, associate professor of medicine at University of California in Irvine, and a chief medical information officer. Jaideep Srivastava is a distinguished professor right here at the University of Minnesota and College of Computer Science and Engineering. He's also attached with the Kanpur IIT in India, and in a new program that has been built that brings together medicine and AI. So with that, Ikram, do we have a message from the governor?
Hello, everyone. Governor Tim Walz here. I can't begin to tell you how pleased I am that this conference is occurring right here in Minnesota. Thank you to Gopal, Minnesota's first Chief Information Officer, for making this summit happen and for your tireless commitment to public service. Thanks to the Data Science Initiative and the Health AI Institute for providing this unique platform for learning, networking, and collaboration. Things we need more of as we drive towards innovation in AI. This event is bringing together leaders in technology, policymakers, investors, and entrepreneurs into a much-needed conversation as we enter a new era of the digital age. Over the decades, we've worked to make Minnesota a global leader in medical technology, and this conference is one more piece of evidence that that work has paid off. I'm proud to say that Minnesota has one of the most robust health tech ecosystems in the entire country. Because of that commitment to innovation, Minnesota was ranked the best state for healthcare last year. A lot of the big players in that process are in attendance here, either as conveners, speakers, or participants. The Mayo Clinic, which operates the best healthcare facility in the world. It's great to see Medical Alley, Medtronic, Optimum, United Health Group, Fairview, Health Partners, and a broad array of private sector companies participating. I'm not too shy to say that Commissioner Tarek Tomes, who heads and the thinking around this technology in our state government, he's here too and leading. And I'm proud to hear that a bipartisan group of legislators are joining you, because we know that the future of healthcare innovation is a bipartisan goal. I like to think that this list, along with the many others I haven't mentioned, is a good representation of how innovation works in Minnesota. We want government, whether the university, other educational institutions, or our state agencies, to be a partner to socially responsible, cutting-edge thinking in our flagship industries. And by attracting new investments in business, we're improving Minnesotans' lives and their health outcomes. That's exactly what you're doing here, powering up our innovation ecosystem for the next generation of Minnesotans. I'm so happy to see this exciting conference happening here in Minnesota, and I wish you the best as you think through the ways that we can, as partners, make healthcare better for everyone. Thank you, DSI, and thank you, HAI, for creating this platform. It's efforts like these that will make Minnesota the center of AI innovation.